Okay, good afternoon, Prof. and my colleagues. And today we are going to discuss regarding the total quality management issue from our group. Our group from me, Dr. Tuan, Dr. Almir, and Dr. Stephen. Next slide. This is our outline. First, start from the background of the healthcare organization, which I will be presenting. Situational analysis, and then the problem analysis using the Ishikawa diagram. Next slide. Background of QMMC, ambulatory chemotherapy unit. Next slide. The QMMC is Quirino Memorial Medical Center. It's a tertiary level government hospital which is located in Quezon City, Philippines. It was established in 1953 and actually formally opened on August 1953, as part of the President Elpidio Quirino's Social Amelioration Program. It is not for profit institution and wholly owned by the government of the Philippines. It is level 3 hospital, tertiary teaching and training medical center, which consists of 1,000 bed capacities government hospital. It is one of the apex hospitals of the NCR in the Philippines and provides tertiary and specialty care, including chemotherapy for cancer patients. Next slide. This is the location of the QMMC in Quezon City near Manila. Okay, next slide. This is the vision and mission of QMMC. The vision in English is premier government medical center recognized globally and championing health for all. And the mission is to provide excellent healthcare, state-of-the-art training, and relevant research. Next slide. The corporate value, there are 7 C's, like clean spirituality, mentally and physically, competent, caring, compassionate, culture-friendly, community-oriented, and communicative. Next slide. Okay, now our issue, we are focusing uh, for ambulatory chemotherapy unit, which is established since the year 2012 and consists of 8 bed capacity unit. It provides outpatient chemotherapy, like infusion services and related anti-cancer therapies, led by a unit head with the 5 physician consultant and 1 to 2 resident physician and 2 to 3 nursing and aides facilitate services on a daily basis. It caters to an average of 200 cancer patients monthly. Next slide.
Now, this
Okay,
is
next slide, I'll
Stephen's.
pass to Ben.
Thank you very much, Dr. Tuan. We are now proceeding with the situational analysis. Next slide, please. We will be using the PESEL analysis as a framework to identify and evaluate external factors that may impact the performance of this institution. From this table, we can see that the highest evidence of impact to the organization is the enactment of National Integrated Cancer Control Act of 2019, which is also the highest impact matrix probability. And it also show the COVID-19 pandemic and the frequent significant weather disturbances. These 3 factors were noted to be a high issue for the institution. Next slide. In terms of the internal environmental scan, the highest impact to the organization are as follows. Focusing on the weaknesses, the absence of non-formulatory anti-cancer medicines, and the poor discharge and follow-up of planning, which will later on be discussed. Also, there is a lack of clear guidelines and SOPs on the limiting number of serviceable patients. Next slide. In terms of the internal environmental scan, the other impact are number one, the limited bed capacity or overcrowding seen in the physical facilities, and the absence of in-house radiation services. But also to note that one of the strengths of the institution is its financing, which is the financing comes from different or multiple sources such as the Department of Health and PhilHealth. Next slide. This is the patient satisfaction survey of QMMC done last 2022, showing here questions related to how the patient felt and what was their experience when they had a consultation in QMMC. And as you can see, it's numbered 1 to 10. And in the column of yes, it was noted that the lowest score was gained from the last question, which was I instructed on the date of my follow-up schedule? This showed to be the lowest score, and this bridged us and this compelled us to learn more about this issue, which prompted us to delve more on this problem. Next.
Thank you very much, Tuan and Stephen. So I'm Alex Hernandez, and I will be presenting our group's problem analysis. So as presented by Stephen, based on the as a product of our findings in the patient satisfaction survey, we will be focusing on the poor discharge planning as the total quality management issue. So for this one, we will be using the four-piece Ishikawa. So four-piece Ishikawa is a fishbone root cause analysis, which focuses on the four P's, which are the patient, the processes, the provider, and the policy factors, for us to better understand the problem at hand. So again, based on the result of the patient satisfaction survey presented, we are to focus on the poor follow-up planning as the healthcare quality management issue. So it will serve as the head of the fishbone or the Ishikawa. So first, among the patient factors, the ignorance or apparent lack of familiarity with the follow-up procedure is seen as the main patient factor leading to poor follow-up planning. The first-time patients or the patients for chemo initiation are more commonly unaware of the follow-up planning procedures. Adding to the patient factors is the lack of reliable caregivers. Because in our institution, caregivers are required for various reasons, and one is for them to assist the patients in all the aspects or steps of the chemotherapy, which includes the discharge planning. And finally, patients invariably can present with memory lapses due to first the inherent condition, which is cancer, and second, due to the side effects of the treatment, and finally, perhaps due to psychological stress. In any case, these memory lapses may lead to poor follow-up planning. So the second set of factors will be the processes or the procedural factors that may lead to poor follow-up planning as well. For example, the apparent lack of discharge planning standard procedure is likely to directly lead to poor planning. Additionally, the lack of integration of the follow-up procedures with the rest of the chemotherapy-related activities are contributory to the main issue. So the third set of factors that may lead to the poor follow-up planning are the provider factors. So the the providers are the nurses and the physicians. And the first issue on this aspect is the apparent role confusion. So related to these process factors, is the lack of standard procedure and assignment on who should conduct the discharge planning, which understandably can be a causative factor to poor follow-up planning. And seldom, these health professionals will provide conflicting discharge planning that will lead to confusion. This is further complicated by the poor explanations of follow-up plans by, by the providers, which in turn is attributed to the lack of enough time for discharge planning. And finally, the last set of factors are the policy factors. So the policy factors are thought to lead to poor discharge planning. So first is the lack of reporting or penalties for remiss in follow-up planning. So for one, since there are no formal reporting or systems, so there are no metrics or measures available to estimate the exact burden of this particular problem. And lastly, the apparent admit all policy of Quirino Memorial Medical Center, which is similar with the other government hospitals, makes it difficult for the unit to adapt with with the increasing number of patients because of the admit all policy. So in the last few slides, we presented to you our healthcare organization of focus, which is Quirino Memorial Medical Center Ambulatory Chemotherapy Unit. And based on our patient satisfaction survey, we learned that the main problem is the poor discharge follow-up planning, and I just presented to you the root cause analysis for this problem. So this ends our presentation, and thank you very much.